Why Idi Stuart is right, Trinidad doesn't need the Couva Children's Hospital yet. In the ongoing debate about the Couva Children's Hospital, the voice of frontline healthcare professionals must be heard. Idi Stuart, head of the Trinidad and Tobago Registered Nurses Association, TTRNA, is not opposing care for our children. He is advocating for smarter, people-centered healthcare decisions. It's time for the public to pause and truly consider his message. We don't need to reopen the Couva Children's Hospital right now, and doing so may do more harm than good. Here are 5 powerful reasons why. 1. Existing children's hospitals are barely half full. It might be hard to believe, but our current pediatric hospitals, the Wendy Fitzwilliam Children's Hospital in Mt. Hope and the San Fernando facility, are operating well below capacity. These modern, equipped hospitals are not overwhelmed. Beds lie empty. Staff walk halls that are too quiet. Before spending billions to open another facility, we must ask, why aren't we filling and fixing what we already have? 2. We don't have the staff to run it. You cannot run a hospital without trained pediatric professionals. Stuart's warning is chilling. Only one neonatologist is practicing in the country. There are no pediatric nurses currently being trained. No neonatal nurses. We are in a crisis, not of buildings, but of people. If we open Couva tomorrow, who will care for the children? Empty walls cannot treat patients. A building is not a hospital. Trained hands and compassionate hearts are. 3. There's no proof we even need it. The public was never shown a health sector needs assessment, feasibility study, or even a basic population analysis to justify the $1.5 billion investment. The decision to reopen appears more political than practical. Trinidad and Tobago deserves better than guesswork and election cycle promises. Our children's healthcare must be driven by evidence, not optics. 4. Fix the broken system first. There are more than 1,000 nursing and midwifery vacancies across the health sector. Nurses have gone 7 years without a wage agreement. Our public health system is bleeding talent, overworked professionals are burning out, and morale is dangerously low. How can we pour money into new hospitals when the ones we have are starving for staff and support? 5. There's a smarter, long-term plan. Stuart and the TTRNA are not saying never, they are saying not now. Instead of rushing to reopen, they propose a 3-year strategic plan to transform the Couva Hospital into a center for tertiary care, including stroke, burn, and cardiovascular units. This can serve local patients and medical tourists, creating revenue and relieving pressure on other facilities. This is vision, not vanity. A plea to the public and the government. This is not about opposing development. It is about making the right investment at the right time. The cries of nurses, the warnings of health professionals, and the absence of basic data cannot be ignored. To the people of Trinidad and Tobago, your emotions are real. You want your children to have the best care. But the best care isn't a ribbon-cutting ceremony, it's having a nurse beside your child's bed when it matters most. And right now, we don't have enough. To the government of Trinidad and Tobago, listen. Not to applause, but to the silent cries from within the health system. Listen to the overworked nurse. To the specialist who has no team. To the empty wards in our existing hospitals. Listen to logic, to compassion, and to those who serve. Open your eyes before you open another hospital.
Minister's announcement that her government intends to operationalize the Couva Children's Hospital is not sitting well with the Nurses Association.
None of the current facilities that children are housed in, it's Eric Williams Medical Facility with the Wendy Fitzwilliam Hospital and the San Fernando facility or in Tobago, none of these facilities are ever overflowing. It is not a case where patients, children cannot get beds. It's never a case where those facilities are even operating at 80%. So really and truly, there is no need.
Association President Idi Stuart says at this time, the public sector is short of roughly 1,000 nurses.
There's only about 100 nurses available, probably less than that, available to be hired. So even if we hire those 100 nurses, we still would have a deficit of 900 plus nurses. Thirdly, we have a further shortage of specialist nurses. And for you to run a children's hospital, you're definitely going to need neonatal trained nurses. You're going to need pediatric nurses. Currently, the focus of the government should be to ensure the trained nursing schools that currently exist, that do not currently train pediatric and neonatal nurses, get them to train those nurses. And that will take 2 to 3 years.
Stuart says due to the severe shortage, nurses are mandated to work overtime for which they are not paid, but are given time back, which does not materialize.
Currently, only one of the RHAs, Southwest Regional Health Authority, who pays nurses sometimes overtime for the hours they work. Everybody else does not pay nurses.
All things considered, Stuart says the government should focus on bettering nurses' terms and conditions, as they are still on temporary employment and 2013 salaries.
Before you go to stop and scrap the revenue authority, before you do all of these things that will increase expenditure and lower income, please, we beg of you, settle wage negotiations for nursing and midwifery personnel.
The association has reached out to the newly installed Health Minister, Dr. Lakram Bodo, requesting a meeting. Renessa Cutting, TV6 News.